Performing balance exercises can improve balance, posture, and gait, as well as reduce the risk and the fear of falls. Balance exercises involve maintaining standing and posture under a variety of conditions. We recommend incorporating balance into everyday activities, as well as performing a specific program 2 to 3 days every week. To do this into your daily activities, just try standing on one foot while you're doing the dishes or brushing your teeth. Just keep a sturdy object nearby, like the kitchen or bathroom counter, just in case you need to hold on to something. When you first start a specific balance training program, this should include one set of about 5 balance-specific exercises performed 2 times a week, with each exercise lasting for about 10 to 15 seconds. Exercises should be based on your needs and abilities and should be selected with safety being a critical factor. It is necessary to clear the environment of any obstacles that may interfere with the exercise, and it's also important to remember that someone with poor balance should not perform these exercises alone. So how do you progress once you've already started this balance exercise training program? You can progress by increasing the time of each exercise up to 30 seconds. Then you can increase the number of sets to 2 to 3 sets of each exercise. And then you can gradually increase the challenge of the exercise. Here are some examples of how to increase the challenge. You can reduce the base of support. So instead of doing an exercise on 2 legs, you will then do the exercise standing on 1 leg. You can change the base of support. So you can stand on a foam surface, such as the one shown here. You may also perform dynamic or more active movements that challenge your center of gravity, such as a tandem walk with one foot directly in front of the other. You can also reduce the sensory input, simply just closing your eyes. As always, even with a balanced training program, perform a warm-up and a cool-down with every session. Start slowly and progress slowly, and continue to use the RPE scale to monitor the difficulty or the intensity of each exercise. Make sure you breathe properly, never hold your breath, drink plenty of water, and maintain proper posture and form throughout each exercise. This exercise is called Tandem Standing. You're going to place one foot in front of the other with the heel touching the toe of the other, and you can hold for 10 to 15 seconds, increasing the time as you progress. Hold on as needed to a sturdy chair and keep upright posture. This exercise is called the one-leg balance. So you're going to lift your foot to stand on one leg, hold for 10 to 15 seconds, again progressing the time as you progress, and you're going to repeat with the other leg, holding on as needed but trying not to if you're able. To make this more difficult, you can use the foam, standing on the foam, doing the same thing. Remember to keep proper posture. This exercise is the standing hip raise. You're going to lift the hip and the knee, hold for 10 to 15 seconds. You're going to repeat on the other leg and hold. Again, you're going to use a chair for support as needed. If you want to make it more difficult, again, you can use the foam pads to lift the hip and knee and hold, making sure your posture remains upright. This exercise is the standing knee bend. So you're going to bend the knee, pulling the heel upward. Hold for 10 to 15 seconds. You're going to repeat with the other leg, using a sturdy chair for support if needed. Again, if you want to make it more difficult, you use the foam pads, bend the knee up, and repeat on the other side. This exercise is called the standing kick. You're going to extend the knee and kick forward, and repeat on the other leg. You can make this one more difficult 2 ways. You can use the foam balance pad and kick, also increasing the difficulty by using a band that you put around both legs, and when you kick, it provides resistance. This exercise is the standing side kick. Again, you're going to extend the knee, kick out to the side, holding onto a sturdy chair if needed. You can make this one difficult 2 different ways. You can stand on the foam balance pad while kicking out to the side, and you can also use an elastic band around both legs to make it more difficult by kicking out to the side and also combining with the balance pad to kick out to the side. This seated balance exercise is also good for maintaining your core musculature. You're simply going to sit on a stability ball or from your wheelchair or other chair. Stability ball will make it a little more difficult. You're going to extend your leg, hold for 10 to 15 seconds, and repeat on the other side, making sure you maintain upright posture.